I'm Osman Sharif. I'm from Sudan. I would like to talk about my experience as a medical doctor. It was 10 years ago when I was working in the rural areas, one of the very remote part of western part of Sudan. One day I was called to see the patient. She was pregnant lady with intrauterine fetal death. And there is rupture uterus with suspected internal bleeding. In order to save this patient, I have to abort the child, the dead child, and then there is no hospital, there is no medical instruments. I managed to use a sharp tool to debulk the head of the dead child in order to abort it, and hopefully I could do that. And then after the patient was very exhausted and unwell and it looks pale, but fortunately after 2 weeks I visited this patient in the village, and I found that the patient was well, and there is hopefully there is no bleeding, and rupture uterus pass without any complication or infection, something like this. And after 2 months I visited the town, the town, and I consult my professor in the gynecology, obstetric and gynecology. I told the story about this patient, and he said where there is no doctors, the God will save his patients. Where there is doctors, the patient will be complicated by the doctors. This is really one of my vivid stories and the experience I have ever known. Thank you very much.